Hi, my name is Steve Doloszycki. I'm the Director of Cardiology here at Franciscan Crown Point. I chose not to get the vaccine initially. To me, it was more a matter of I just didn't really think I was going to get it. And for me to go down that road and expose myself to a vaccine that's fairly new prompted some concern. So I chose to think that it's not going to impact me, I'm going to be fine, so really what's the point? And found out that that wasn't necessarily the case. I started feeling a little under the weather. It progressed over the next couple of days, and I got tested on Sunday and was found to be positive for COVID. Well, when I first got diagnosed, I wasn't overly concerned. I work out 5 to 6 days a week. I think I take good care of myself. I'm not overweight. So it didn't really create that sense of urgency. But as time progressed and the more debilitating effects started to manifest themselves, and I started getting, concerned with my breathing and the fever, and yes, I did become very concerned. 3 days after the diagnosis, I ended up getting admitted into the hospital here through the ER, and spent the next 4.5 days in the hospital undergoing treatments, remdesivir, steroids, very aggressive, steroid treatment to help promote my breathing. And my recovery continues even today. Walking from one department to another, I can all of a sudden experience shortness of breath, malaise, and actually have to sit down for a few minutes until it passes. And my greatest fear is 3 months from now, I'm still going to be dealing with the shortness of breath and the malaise and, the stress and anguish that comes with it. So I said I was always a healthy person and I never worried about walking around the block. Today I do. What I would say is some of the biggest irony of this whole circumstance is that I am over our COVID rehab program department here. I've spent the last few months working with Dr. Infacino very closely to establish a program to help rehabilitate the COVID long haulers that come here into the program, who experience shortness of breath, malaise, general fatigue, all the things that I'm going through right now. So I was first and foremost seeing that on a daily basis, and it still didn't register and click that I could have avoided all this just by going down and getting that vaccine. Thinking about it, I guess not only the health ramifications, but the fiscal concerns as well are something that I didn't think about before that now I'm facing. Having to take time off work, having to utilize PTO and short-term disability. Now also I'm starting to see the bills. Let's face it, getting hospitalized for 5 days is not cheap. I'm going to have to, pay those bills, and I guess potentially a lot of this could have been avoided. I would have to say ultimately everybody needs to get this vaccine. I don't see why I didn't pursue it in the first place. And going through what I've gone now, I would definitely tell everybody I know that there's more benefit in getting it than not.